Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Let's look at IVF success rates. IVF success is usually defined as a live birth per IVF cycle, and it's not just a positive pregnancy test. Success rates vary significantly based on age, egg quality and embryo quality. Also, there are some issues like, do you have a good endometrium? Is your egg quality good? Clinic protocols, a number of things are involved. Average IVF success rates by age, which is live birth per cycle, is defined by age group. So let's look at the age group success rate per cycle. Under 35 to 45, it is 55%. 35 to 37 years, it is 35 to 45%. 38 to 40 years of the woman is 25 to 35%. 41 to 42 years, if a woman is that old, it is 10 to 20%. And if it is more than 42 years, it is less than 5 to 10%. So according to CDC, ESHRE, ICMR, which is Indian board, reports and fertility clinics worldwide, let's look at some of the success rates. But specifically, I want to talk about IVF success rates in India, which is a 2024 estimate. Overall, IVF success rates in India are about 30 to 35% per cycle. With donor eggs, it is 50 to 65% and it varies by clinic and age. Frozen embryo transfer, which is called as FET, is about 35 to 50% and blastocyst transfer is about 40 to 60%. It's better than cleavage stage, which is day 3. Some key factors affect IVF success. Most importantly, the woman's age. It's a very critical factor. Egg quality declines sharply after 35. Egg and embryo quality both decline. Better quality leads to higher implantation and live birth rate. Endometrial health is also affected. A receptive uterus is essential for implantation. Sperm quality is important. It affects fertilization and embryo development. The number of embryos transferred is also important. More embryos may increase pregnancy rate. Also has a risk of multiple fetus. Lifestyle factors such as smoking, alcohol, stress and BMI can have a drastic effect on the success, so you need to reduce that. There are some causes that we need to talk about. Tubal, if the tube is blocked. Male factor, unexplained infertility. The clinic's expertise and lab quality is a very important factor. What are the culture conditions? What is the culture medium used? How is the embryologist? What are the skills? These are very key factors. Cumulative success rate is also important and we need to talk about it because IVF success increases with multiple cycles. Cumulative live birth after 3 cycles is about 70 to 80% if the woman is under 35 years. If she is 35 to 40 years, it is 60 to 70%. Above 40 years of age, it decreases to 40 to 45%. There are some add-on procedures that you can opt for to improve your success, such as ICSI, intracytoplasmic sperm injection for male factor, blastocyst culture, laser assisted hatching, ERA, which is called as endometrial receptivity array, PGTA, which is for chromosomal screening in embryos. But be aware that these may not be needed for every patient and should be based on individual indications. So your success in an IVF cycle is clearly dependent on number of factors. Don't be disheartened with a negative. You must always go for another cycle so that you can increase your cumulative success rate. If you wish to know more about this, please feel free to contact us. Thank you.